Namaskar, Swagatam. We would like to welcome you all on in IRES AYUSH SAMRIDDHI platform. Thank you very much for joining us today. I welcome Professor V.K. Agnihotri sir, Professor Vishnu Prasad Sharma ji, Professor Kamini Dhiman ji from All India Institute. Welcome.
नमस्कार
नमस्कार नमस्कार जी. आज लक्ष्मी जी कामिनी जी दोनों ही साथ में हैं. जय हो जय हो. रहिएगा पूरे तक. दो ही स्पीकर हैं, जरूर रहिएगा. I welcome Tulya Mohan Das, Vice Principal of the college there. Welcome, madam. And all the audience, welcome by heart, because without your cooperation, without your guidance, mentorship, and sincere blessings, this journey was not possible up to 463rd webinar today, within 2.5 years. Thank you. Everybody is contributor here to maintain, to achieve this height. Thank you very much. Without wasting much time, I would like to request Professor Vishnu Prasad Sharma ji, President Vishwa Ayurved Parishad Assam, ex-principal, Government Ayurvedic College, Guwahati. Welcome, sir. Welcome.
Namaskar. Good evening to everybody. Respected Professor V.K. Agnihotri ji.
Namaskar. Namaskar.
Respected Dr. Pawan Kumar Sharma ji. Eminent speaker, distinguished guests, ladies and gentlemen. Today we have evening webinar on girl health care, best Ayurvedic way. So in this webinar, we have eminent speaker, Professor Dr. Laxmipriya De, HOD, Department of Prostati Tantra and Stri Roga from Jamnagar. I welcome Madam to this evening webinar. Next, I want to welcome Professor Dr. Tulya Mohan Das, HOD, Department of Kaya Chikitsa, Ayurvedic College, Coimbatore. Welcome, Madam, to this evening webinar on girl health care based Ayurvedic way. So once again, I welcome all the distinguished guests, ladies and gentlemen, eminent speaker to this evening webinar on girl health care based Ayurvedic way. Namaskar, over to Pawanji.
Thank you very much, sir. Thank you very much. For initial words, I would like to request Professor V.K. Agnihotri ji also. Then we will start our journey with Laxmipriya ji.
Thank you, Dr. Pawan Sharma ji, and namaskar सभी को, और विशेष रूप से हमारी गेस्ट स्पीकर्स को और आज के जितने भी इस प्लेटफॉर्म से जुड़े हुए लोग हैं, इंक्लूडिंग प्रोफेसर कामिनी धीमान जी, आदरणीय जगदीश वर्मा जी. Well, as per the today's topic, girl health care, best Ayurvedic way. What we feel that since the today's guest speakers both are our respected lady doctors, so it itself proves that the whole strength of the webinar, whole strength of the concept, and the best way possible for the girl health care is supposed to be extended by the mother herself. So this is what the pleasure point, that our guest speakers are the Matru Shakti along with the whole concept, because not only the Matru Shakti, the प्रसव संपन्नता भाव उनके ही साथ है. तो ये बताते हुए कि अगर कोई गर्ल चाइल्ड के बारे में हम चर्चा करते हैं तो निश्चित रूप से हमारा चर्चा करने का जो परम उद्देश्य बनता है वो मातृ पूजन, कन्या पूजन और मातृ सम्मान की बात ही है. हमने बहुत गहराई से सोचा और हमने ये पाया कि सब लोग कहते हैं हमारे रगों में, पुत्र हो या पुत्री हो, हमारे रगों में माँ बाप का खून दौड़ रहा है, हमारी धमनियों में माँ बाप का खून दौड़ रहा है। अगर हम फिजियोलॉजिकल और बायोफिजियोलॉजिकल की बात कहें तो मेरे दिमाग में एक बात स्ट्राइक करती है, बड़े गहराई से स्ट्राइक करती है कि माइक्रोस्कोपिक स्पर्म, माइक्रोस्कोपिक ओवम, उस माइक्रोस्कोपिक स्पर्म में कितना ब्लड होगा? माइक्रो मिलीग्राम से भी शायद कम होगा। केवल जीन्स जरूर उसमें कैरी करते हैं। और ऑन अदर हैंड वही जब मदर के ओवम से फ्यूज होता है और उसके बाद से जब वो फीटस डेवलप होता चला जाता है तो टोटल मदर ब्लड के द्वारा ही उस फीटस का डेवलपमेंट होता है और उस फीटस का पूरा न्यूट्रिशन नरिशमेंट उसको मिलता है। तो ये कहना ज्यादा समीचीन होगा कि प्रत्येक प्रोजनी में, प्रत्येक संतान में माँ बाप के बजाय माँ का खून बहता है। बहुतों ने बायोलॉजिकल का सोचा, पिताजी का तो मात्र और मात्र एक स्पर्म का कंट्रीब्यूशन होता है। और सारे हमारे बंधन जी आज उपलब्ध नहीं है जो इस चीज को और गहराई से पकड़ते कि वो अच्छे से उसको तोला माशा रत्ती और एमकेएस सिस्टम में बता पाते कि कितने माइक्रो 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 मिलीग्राम मिलीलीटर ब्लड शायद पापा की साइड से होता होगा। तो मेरी ये खुशी है कि हमारी मातृशक्ति हमारे साथ है और इतने अच्छे से बताएंगे। बल्कि पारुल जी भी जुड़ चुकी हैं। मैं तो सोच रहा था अगर हमारी थर्ड स्पीकर पारुल जी और फोर्थ स्पीकर अगर हमारी विश्वप्रिया मोहंती जी हो जाती तो वास्तव में पूरा एस्टेब्लिशमेंट होता कि बालिका की स्वास्थ्य की परिचर्चा पूरे हमारे काष्ठ संहिता से लेकर चरक चक्षु से लेकर जो विस्तारित की गई है। आज हम सब लोग वही सब चर्चा सुनने के लिए बुभुक्षित बैठे हुए हैं और आपका तहे दिल से स्वागत करते हैं कि आप सब लोग अपने पूरे ज्ञान के द्वारा आज कैसे तय करेंगे कि WHO के द्वारा स्थापित की गई बहुत सारी परियोजनाएं जो बालिकाओं पर लागू होती हैं, हमारी जो जननी सुरक्षा योजना है, हमारे भारत सरकार की इतनी योजनाएं हैं, उन सब के प्रैक्टिकल एस्पेक्ट पर कैसे जोड़ दिया जाए, वहां पर हम अपने आयुर्वेद को कहाँ पाते हैं, उस योगदान के लिए आप सबका आमंत्रण है। बहुत बहुत शुक्रिया और इस अपॉर्चुनिटी को देने के लिए डॉक्टर पवन जी का धन्यवाद। ओवर टू डॉक्टर पवन जी।
हरिओम सर, thank you very much. Now I would like to request प्रोफेसर लक्ष्मीप्रिया देई जी। लक्ष्मी जी दर्शन दीजिए। हरिओम। लक्ष्मी जी कहाँ हैं?
बहुत बहुत प्रार्थना करनी पड़ती, लक्ष्मी जी इतनी आसानी से दर्शन नहीं देते हैं।
ये भी बात सही है।
बल्कि हरि के साथ में बुलाना चाहिए तभी लक्ष्मी जी आती हैं।
जय हो जय हो। तब तो लक्ष्मी नारायण चले आते हैं संग में सर, पैसा भी आ जाता है। अरे लक्ष्मी जी कहाँ है?
अभी तो दिख रही थी थोड़ी देर पहले।
हाँ अभी भी अनम्यूटेड है। आपकी
माता
आवाज नहीं आ रही है।
माता पार्वती जी ने कहा था न हम प्रकृत्या चंचला। जब माता पार्वती और माता लक्ष्मी का जो वार्तालाप संवाद हो रहा था वहां पर उन्होंने कहा न हम प्रकृत्या चंचला। ऐसा हमने 6-7 में पढ़ा था। तो आप दर्शन दीजिए।
वो शी इज रीजॉइनिंग जस्ट नाउ।
शायद कलियुग में नारद जी का प्रशंसा नारायण के लिए हो तो लक्ष्मी जी चैलेंज करी थी। कहानी बताऊं अंत में?
हाँ बिल्कुल बिल्कुल। लक्ष्मी जी रीजॉइन कर लीजिए।
फोन से पता करिए अगर उनको थोड़ा समय लगना हो तो।
रीजॉइन कर रही
कर रही ठीक।
आदरणीय दिनेश्वर प्रसाद जी को नमस्कार। वेलकम डॉक्टर राजेश्वरी।
हेलो।
हरिओम।
हरिओम।
क्या हुआ?
Now my slides are visible.
You are visible.
Just I am sharing my slides. Okay.
No problem.
Now it is visible.
Yes.
Okay.
Great. Kindly proceed.
ओम श्री जगन्नाथाय नमः। ओम श्री धन्वंतराय नमः। ओम गुरवे नमः। Good afternoon to all of you. Respected host of this webinar, पवन शर्मा जी, विनीता अग्निहोत्री सर और मदन ठांगवले, विष्णु प्रसाद जी, today's guest speaker Tulya Mohan Das ji, and my dear Kamini madam, Parul madam, and all the participants, those are connected with online in this auspicious day, that is the girl health care best Ayurvedic way. So really the reproduction or the preserve the next generation, it is the God gift for the girl child. But if we see that it is a gender bias, so always the girl child, they are ignored, and they are always suffering from the childhood up to their ending. But they are just like जैसे दिया का वो जलते जलते सबको आलोक देता है, इस तरीका से ही जीवन होता है एक वुमेन का, जो ही शुरू होता है एक गर्ल चाइल्ड से। जब भी घर में कोई लड़का पैदा होता है तो हम भी आज वी आर गायनेकोलॉजिस्ट, so when in delivery room there is the born of a female child, then nobody is happy. But when there is a male child, then everybody is very very happy. But if you see, these are the both the male and female are the both side of a coin, and without one wing the bird can't be fly. But still then, why this is the discriminancy in our society? But if you see from the Ayurvedic side or from the Vedic era, there is giving most respected person, that is the female one, and starting from the education to the battlefield, and in every step of the life, the Narjaha Purjante, Narja Jatra Purjante, Ramyante Tatra Devata. That means it has given the seat like a god. So, and we also know that is the woman, she is the center point of the family. And if we educate one woman, then our whole family will be educated, and the society, and ultimately it is the utilized for the prosperity and for the growth of our nation. So that's why the National Girl Child Day, that is the 11th October, it is celebrated. So let us see that what Ayurveda is saying regarding the girl health care. So if we see the aims and objective of the girl child care, that is, it is the promoting the awareness about the rights of the girl child, increase the awareness on the importance of the girl education, their health, their nutrition, to promote the girls' position in society and to make their living better among the society. So what is the steps taken by our government? So Government of India has taken the several steps over the year to improve the condition of the girls. Government has started the several campaign programs and some themes for the 2022 are Save the Girl Child, Beti Bachao, Beti Padhao, Sukanya Samriddhi Yojana, and a CBSE Udan scheme, free or subsidize the education for the girl child, reservation for the women in colleges and the universities, then national scheme of initiative to girl for the secondary education. So if we see that is it is the efforts. हाँ जी
लक्ष्मी जी, ये आपके ऊपर एक पट्टी आ रही है, देखिए स्टॉप शेयरिंग लिखा है, उसके बाजू में आप मिनिमाइज कर देंगी तो वो हट जाएगी, अदरवाइज आपकी हेडिंग छुप जा रही है.
Okay. Now it is
Yes,
okay.
thank you.
So life course, the approach for the women health, that from newborn to the child, and then there is the reproductive age, and then the menarche. So there are the various phases that is the woman the overcome throughout the life. So the epochs, if we see, then in Ayurveda it is said as the Bala, that is the childhood, Rajaswala, that is the reproductive phase or reproductive age of the woman, then the Brudha or the old age. So why we give so much importance to the girl child? Today's girl, tomorrow's woman, and tomorrow's mother. So if we give the importance, that is the Strisu Priti Visheshena, Strisu Apatyam Pratishtita. So without Stri, the Apatya or the Praja or our next generation can't be possible. And the Dharma Artha Strisu Lakshmi Sucha Strisu Lokai Pratishtita. Here Loka means that is our nation, or that is our nation itself. So again, by Ayurveda it is telling that Bharjayam Rakhyamanaaya Praja Bhavati Rakkhitah, and Prajayam Rakhyamanaaya Atma Bhavati Rakkhitah. So for the preservation of our generation, it is absolutely need of the woman, and who is the from that is the seeds, that is the child is the seed for a woman. So without child there will be no mother and no child. So for that purpose, and there will be no a prosperous nation. So to achieve a prosperous nation and a growth of our nation, we need the women health, and that is the basic is the from the ground level, that is we have to take the care of the girl child. So Stri, that is the Sanchyate Sukra Sonita Asyam Sastri. So who is called this Stri? That who has the capability, that is to to bear the sperm and ovum, and ultimately to give the birth of a child. So in Veda, that is Stri is compared to the earth, and Purush is compared to the Akash. And Stri hi Moolam Apatyanam, Stri hi Rakhyati Rakhita. So it is giving too much importance that to take the health care of the female by our Vedic. So if you see that is the various stages of the Bala or the girl child, according to Ayurveda, that up to the 5 years it is called as the Bala, and from 5 to 11 years that it is called as the Mugdha. That is, it is the main is the pivotal age. That is Mugdha is the pivotal age. That is how it is the changes in their in physics, in the physical growth, and it is the preparative phase, that is for the reproductive organs, it is growing. and the full phase when it is, then in 12 years there will be the starting of the menstruation of the menarche, and from 12 years to 22 years it is the praudha and pragalbha, and from the sorry for the printing mistake. So there is the pragalbha, and then praudha is, that is the 41 years above. In Parasara Samhita, that is up to the birth of the child up to the 8 years, it is called as the Gauri. That is the Balavastha or the childhood. And then the Rohini in 9 years. 10 years it is the Kanya. So everybody knows that is now Navratri has been gone. So it is the Kanya Pujan. And if you see that is in Nepal, I think it is the Kanya or the that is the in 10 years or the 8 years who has not menstruated, and that child, she has the Osip as the goddess. So above then starting of the menstruation, then it is called as the Rajasala. It is the pre-pivotal age, that is 8 to 10 years also, that is sometimes precocious puberty. In the first the menstruation is starting, and the naturally 12 year, according to Ayurveda, it has been telling that 12 year is the main, it is the starting of the menstruation of the monarchy. So if you see that is the how we take care of a newborn girl child, that is the from very beginning, that it has been told by our Kasyapa, that is Kumaraha Prasabe Taila Kumari Prasabe Ghrutam. So if there is female child will born, then the mother should take the Ghruta. And if there is the born of a male child, then Taila should be taken. So if you see, that is how importance is given to the female child in Ayurveda. And after the delivery, girl's child should be given the Abhyanga with the Ghruta also. So it is also telling that when the female child is born, then the family members, they are telling us the Laxmi is born, or Laxmi is coming to our house. So then the changes before the menarche or the pivotal age. So balanam api baya parinamat sukrasya pradurбhavah bhavat, and romoraji chatha vishesam narinam. So during this pivotal age, there is the development of the secondary growth, and there is the due to the importance of the sukrasya. That means here the sarvadahika sukra are the hormones. There is changing of the hormone. So there is the secondary growth, and there is the pubic hair and the axillary hair are the developed, and there is the physiological changes. In female, the first there is development of the pubic axillary hair and then breast, and final the onset of the menses. So this is telling us the Kanya. Then, so in this Balavastha, what is the importance? What is the role? So in Balavastha, that is in Ayurveda, it is hina jonyastu balayaha kayam gacchati sonita tata purna svabhat kayam jonim cha gacchati. So this Balavastha, it is the undeveloped stage of the reproductive organ. So that's why the blood or the sonita, the blood or jiva iti khyata sonita. So artabam sonitam also. So this blood, it is utilizing for the growth and the development of the whole body and the reproductive organ. And when it is the fully developed of the reproductive organs during this Balyavastha, Kanyavastha, so then from the 12 years onwards, then the menstruation started, and which is called as the reproductive sign of the reproductive period. But again, it has always been also taken that from 12 years, it is the starting of the menstrual cycle, but purna 16 varsatu stri. That means fully develop of the reproductive organs. It takes also another the 4 years, that is the 12 to 16 years. That is for the fully developed. And so the after the 16 years, then and then only Ayurveda was advising that you can give the marriage. But now our Indian law, so it is after the 18 years.